fact that families with all the resources on earth are struggling with mental health care and getting their families what they need. You can only imagine how bad it is for people who don't have those resources. Yeah.
Yeah. Welcome to Let's Talk About It Tuesdays, where I share conversations that I have with successful women, all answering the same questions. And then we simply chat it up a bit. You get to be a fly on the wall in these conversations.
My discussion today is with Dr. Rupi Legha, psychiatrist, internationally recognized speaker, and founder of Anti-Racist MD. As a mental health advocate, Dr. Rupi sees the importance of healing through equity and dignity, and the power behind providing healthy, supportive systems to everyone. As a woman who endeavors to bridge social justice with clinical care, she doesn't shy away from a conversation about quality of life. This is my chat with Dr. Rupi Legha. Hello, happy whatever day it is today. Welcome
Thank
to
you.
Let's Talk About It Tuesday. I'm just going to dive right in and ask you our first question, which is, what is quality of life to you?
Aw. Let's see. Quality of life to me, conceptually and theoretically, is abundance, it's freedom, it's joy, it's nourishment. And let's see, on a day-to-day basis, what it actually looks like for me. Um, it involves walking the dogs regularly and staying active, running, Pilates, walking, whatever it is. It's community and connection with the right people and not with the wrong ones. And it's purpose and meaning in the work I do.
I love it. I love the word that you used, nourishment. Would you mind sharing a little bit more about that?
Yeah, nourishment, I think people probably think about nutrition and food when they think of that. And it applies to that, but I think just this idea that you are worth supplementing and enriching and nourishment I think we'll often think about for like bottle feeding a baby or something like that. But
Yeah.
it's like all the ways in which we can feed and enrich and yeah, nourish ourselves.
Yes, I often use that word with of nourishment when we're talking about food, right?
Mhm.
Pick foods that nourish our body. Don't just fill us up.
Right.
And I see the parallels here with how we're living life. Pick things that nourish us and not only just make us feel good, but actually are really good for us. So,
Mhm.
you already answered my second question,
Mhm.
which is
Yay.
how do you apply your ideal quality of life to your everyday life? So, is there anything you want to expand on before I jump to the next question?
Sure. I mean, I think good rest means a lot for me. And I find just like with the circadian rhythm, getting up at the same time, more or less, and going to bed at the same time, more or less, and getting good rest and sleep. Um, and then I think as the years go by, I've become much more intentional about my energy and time and who I share it with and who I receive it from. And yeah, I'm very deliberate, even picky about that.
Yes. Yes. Yeah, because we only have so much time, energy, and space, and who are we giving it to, and who are we receiving from is such a vital question to always be considering. And
Yep.
especially in the work that you do, which I cannot wait. Well, I can wait to dive into that a little bit more because there's such a value and a beauty and an importance to what you do. So, okay, but before we go into that, so where are you challenged to incorporate your quality of life?
Uh, I feel challenged in the realm of loneliness and being alone, um, and connection. And I'm in a space where I don't have a lot of family readily accessible, and because I operate my own business independently, I'm not kind of tied into a workplace setting, and I'm an LA transplant, and so. Um, as I'm very deliberate and picky about where my time and energy goes and who it's with, I think finding really meaningful connection and community has been tough, and that's something that has been persistently a challenge.
Hmm. That's a challenge for a lot of us. Thank you for bringing that up. Where, we, especially when we step into the life that we know that we're supposed to live, sometimes that just ends up being a shedding of the people that are no longer wanting to walk the path with us. And whether it's our choice or whether it's their choice, it's still sometimes there's a fallout to living purposefully.
Yep, could not
Yeah.
agree more.
So what do you do to, kind of work alongside that so that it doesn't overwhelm you or overtake you?
The loneliness.
Hmm.
Yeah, I think that's a work in progress. And I would say that the weenies have helped a ton. My
Please
two
explain
little,
what the weenies are.
but wait,
Oh,
they're taking a nap.
just in case anybody was wondering, this is the weenies. Or yeah, here we go. I love it. Yeah, so you're getting loved on already.
My little Muppets.
Yes. Aw. Okay,
You
so
know,
please introduce them.
yeah. So this is Saint, aka Yves Saint Laurent, and this is Sachi, aka Versace.
What a lover they are. Oh my gosh.
Yeah, so they're a big part of my life and we're a family. And
Yeah.
so I think that has just been a wonderful game changer for me. And then I think there was a shift during the pandemic and even coming out of the pandemic. We were at home and I was at
Yeah.
home so much. And so it was really physically like what was proximal to me and the people around me in my neighborhood. But as we've come out of the pandemic, and certainly I've come out of my cozy cave with work and life, I've kind of been reminded that I'm very much a citizen of the world. A lot of my life has been spent seeing different parts of the world, working in different parts of the world. Perhaps more than most people. And I think in the past year or so, I've returned to being a citizen of the world and
Yeah.
traveling a lot more. I think also realizing that in this new world order where I do not have to go to an office every day in the same city where I could really be anywhere and working from anywhere, definitions of community are shifting a lot. And so
Mhm.
I think I before thought that it was meant to be around me in my immediate 5 mile radius, and now I realize that that is not the case. And I'm a soon to be godmom to a new baby on the opposite side of the country, and what will it look like to be in community with that child, and with other people who are important to me. So I think maybe embracing citizen of the world and realizing that community is just so global these days.
Yes, yes. And I've thought about that for myself as well because I have a similar experience where a lot of the connection that I have is really outside of my area community. There's a lot that goes on in where I live where I don't feel connected to a lot of people. And I do find this that I miss the, hey, what are you doing for dinner? I made extra
Yeah,
such and such. Come on
right,
over.
right.
You want to have a glass of wine type interaction, which could probably still exist in some ways. But as I am leaving my area as well to kind of make connections out of there, I am also, and I'm sure other people are too, trying to figure out like what does this whole community thing look like now that we have access to so much more around us, especially the one thing that I see, the pandemic, right? It it made us all more accessible online.
Yeah.
Yeah. So that's, I mean, that's beautiful. And I think shifting that perspective can be so crucial to all of us as we just kind of, figure out how do we combat this loneliness or, incorporate more quality into our life. And we think outside the literal box, literally. Yeah.
Yeah, I think the other thing that comes to mind is like community around issues or things that whatever it is that we care about, whether it's hobbies, spirituality, professional life. And for me, community around the work that I do has become increasingly important, in part because there are elements of movement building there, and it seems like people are more ardently organizing around the issues that matter to them, and so I'm finding that people who reach out to me because of the work that I do or the papers that I've written, or if we have a convening next week where there's some kind of retreat or conference around this issue that we care about, I'm finding that there is more pull in those settings than there was a couple years ago.
Yes. And you set me up perfectly for my next question for you because you are definitely, I just mentioned, thinking outside of the box, and you are definitely someone who is not only thinking outside of the box, you are living outside of the box and promoting outside of the box. So please share with us what you do for work and also how did you come to have such an interest in this?
Yeah, great question. So I'm a psychiatrist. I'm boarded in child and adolescent psychiatry and also adult psychiatry. I have a background in global mental health. I worked in rural Haiti for 2.5 years, in Peru for 6 months, and have encountered people from all walks of life and all parts of the globe through my work. And about 5 years ago, I founded my entity, Anti-Racist MD, which some seeds were planted a few years ago, and now I'm trying to build it up. But it's an organization entity reimagining mental health through an anti-racist lens. And I guess the long and the short of it is that mental health interventions are often traumatizing for people, and there's a lot of overlap and complicity with coercive and oppressive systems, whether that's policing, or for kids that I see, juvenile detention or foster care, things of that nature. And it's not working for most people. Mental health outcomes are shoddy. Mental health crises are everywhere. So, I think the prevailing narrative is that we just need to get more of what exists to people who need it. And I adamantly disagree with it. I think whatever we're doing is not working, and I'm not the only one who feels that way. And that we just need to do something drastically different from what we're doing right now. And so I have a clinical practice. I see kids and adults and families of all ages. I'm licensed in California and a bunch of other states as well. And then I do a lot of writing and teaching, trying to nudge paradigm shifts in healthcare, mental health care, psychiatry, child psychiatry.
Beautiful. Thank you for doing the work that you are doing. It's
Mhm.
so important. So how did you get into it? How did you get into this next level of your psychiatry career?
Yeah, like many people who become doctors, I had a parent who was a doctor, which, I think says a lot about the layers of privilege that are there, and, who has access to this kind of profession. And so I have siblings who are doctors as well. And so, it's kind of a family trade. But going into it in medical school, I started and immediately was like, what is this? So much of it did not sit well with
Mm.
me. So much of it felt so against my intuition about how to care for people and provide treatment for people. And so that started 20 years ago. And then I went through medical training, as you're required to do: medical school, residency, fellowship, all these things, certifications. And then once I had finished all of that, I think I just sort of had a crisis of consciousness where I started looking around at everything that I was doing, all the standard practices that I was participating in or even pushing against. And it just felt so wrong on so many levels. And then when the pandemic hit and our latest racial reckoning in our country, I think some of the um, contradictions and conflicts that I was feeling and seeing every day, they became completely intolerable. And I realized I had to exit all of the existing settings that I was, in teaching in academics, working in hospitals and clinics, and get completely out of that and set up my own thing and sort of start over entirely.
Mm, yes. I have noticed recently, thank you for sharing that, by the way. I have noticed recently that there has been and more of an embracing culture of therapy, getting different modalities of therapy and, healing some of the things that have gone inside us. And I love that part of where we are. And there's a reality to A, being able to get affordable. B, what happens, once we're in it, how effective is it? We have talk therapy, we have, and so I really value and appreciate this additional layer that you're bringing to the table of like, is what we're doing actually working? Is it effective? Is it really healing? And
Yeah.
I know a lot of what you do is you bring to light the history of our systems as well. What stands out to you the most out of some of your studies recently?
Yeah, I think what stands out to me the most I mean, I know the most about psychiatry as a discipline and psychology to some extent as well, but have also probed this in other medical specialties like OB-GYN, obstetrics, gynecology,
Yeah.
surgery, medicine overall. And, if you pull back, you don't have to pull back the layers. If you just look at what we're doing today and know the history and where it started and how it evolved, the histories of slavery and colonization in particular are so deeply tied to these broad array of health disciplines, and that there's been no profound historical reckoning with what those roots mean, how they show up today, and what we are doing to undo that. And simultaneously, we have pretty abysmal health outcomes in our country. And then the racial health inequities and other health inequities are awful. Most of them were staying the same or getting worse up until a couple of years ago. And then I think, in the coming years, we'll see it probably just intensify
Mhm.
on another scale. But it's just the fact that and maybe I say pull back the layers because you are not required to learn any of this stuff. And in fact, I had to go looking for. I mean, I really had to kind of
Yeah.
excavate it in the sense that I had to go to other disciplines, whether it's history,
Mhm.
sociology, health policy, and other things. But nobody taught me this. This was not part of my professional training or accreditation in any way. But I think it felt so vital for me. The person who started med school and kind of came in and immediately felt like something was wrong and things were off and things that I was seeing did not make sense, just in terms of how damaging they were to people. And then when you start to see the history, you see how that's all tied together, and it's very clear what the imperatives are to change things, yet none of that. I mean, there's been a little bit more conversation about it since George Floyd's lynching back in 2020, but really, there's been nothing of
Right.
depth that has
Yes.
changed.
And as you're saying that, I'm thinking the majority of us, we don't know this history. We
Yeah,
really don't. We have, you know, it's starting to be a little bit of a sprinkle here and there. Social media is doing some promoting. You're doing a lot of promoting. But the majority of us don't know where a lot of these procedures that we currently practice, whether it's medical or psychiatric, started from, how they were so racialized in their practice, and so we don't question it. We just kind of go along with the norm of, okay, this is what my doctor said,
right.
this is what I'm supposed to do. And yeah, you're right, we are at a place of crisis with it. So
Yep.
how do we step out of that into something different?
Yeah, so I think there are and there have been burgeoning movements of people um, who are thinking about these things and actually doing things about them. And it's people who survived these things that are at the forefront of these movements. So whether it's,
Yeah.
disability justice in particular in the mental health realm, racial justice more broadly. For instance, I'm attending a conference next week about mental health rights and recovery. And it will have a strong presence of folks who are part of the peer mental health movement, which is the idea that people who've gone through these things are the best advocates and supports for
Yeah.
treating and addressing these things. Like if
Absolutely. Yeah.
the professional titles are not necessarily at all, and especially if you think about the histories of the professions, they're often harmful. And so There are people who are addressing these things directly. There is a large movement to rely on communities first instead of the police and other first responders for mental health crises. So there are all these things that are there and that have been around, mutual aid support. There's so many things where people are sad and distressed because they don't have their basic needs met related to housing, food, healthcare, and Prozac won't fix that. And so,
Right.
yeah, there are lots of movements that have been around for a long while and that are picking up steam. Definitely, I've noticed in the past couple of years, there's a lot of folks who are coming forward about their histories of being on psychotropic medication.
Mm.
And certainly, in my own practice, I see a lot of young adults and even middle-aged adults who I'll often say they're living with the wreckage of child mental health interventions from their childhood
Mhm.
and their youth, including feeling forced to be on medications at a young
Yep.
age, and then, having awful side effects and or struggling with coming off of them and really having a hard time finding a medical provider who will support coming off the meds entirely. Yeah.
Yeah, because as we think about it historically, so I grew up in the 80s, right? And if there was anything going on with anybody in our youth, it was very common practice to, you're going to go away to one of those camps. You're going to go to a way to where, you're basically punished and or controlled so that you get your act together. The words healing and community were never really a part of how we responded to this. And I mean, I know people in my life who are having youngsters, and I'll call them youngsters. Boy, that just make me sound like a vieja, right? Who have emerging adults who are really having a hard time, and we are able to identify or label those things differently now. But really, what's different about how we're responding and to it, and how scary it is for the parent.
Yeah. Yeah.
And
Uh,
so with that, what are some ways that you encourage us as a parent or who is seeing what may be going on with our child, um, and really doesn't know what to do, and the knee jerk is to go into the systems.
right. Right. Yeah, no, and this is the dilemma that parents are up against. I mean, I think there are different ways to think about this. One is if you are going to find a provider, to find one who is aware of these entrenched risks in child mental health as being sent away to facilities where risks of abuse and mistreatment are high, risk of being pumped full of medication, risk of being overly pathologized and blamed, and then, not really understanding how that can affect a kid throughout their childhood and even into their
Yeah.
adulthood, just how damaging that can be to be labeled the problem. I think a more expansive view of kids, that kids are not inherently pathological. They are often signaling something that is not right in the world, in the community, in a school setting, in a family setting. So to really understand that young people are often communicating something, an important message that we all need to hear. But they often get labeled with a bunch of different diagnoses
Yeah.
or blamed for being a problem. But I think to like really shift gears with that. And then I think to connect to other families and communities. That's not a world that I'm as tuned into, but I know that there are parents. I know that there are parents who are hip to this because I've met with them and spoken with them and have worked with them. And so I think there are networks of families who are quite aware of this and want something different and are finding ways to unearth that and finding providers who
Mhm.
align with that, finding pure health supports that are less biomedically oriented, less pathologizing, less extractive, less reliant on separating families.
Yeah. There's such a power in being a part of a community or a network with people who are potentially or possibly experiencing the same things with their kids or within their own family dynamics. Because, first of all, I think there's a beauty. I've experienced this for myself and being able to talk about it unedited with someone who can go, oh, yeah, yeah, that's happening with me too.
Right.
Also, getting ideas from other people. What worked? What didn't work? Oh yeah, I went to that thing. Stay away from that. Or try this.
Yeah. Yeah.
You
That's
know,
right.
and so that is very helpful in when we already know what we're dealing with. What about, is it okay if I kind of keep poking? Is it okay?
Yeah. Of
Okay,
course.
good. Because what about the parent that is seeing, oh my gosh, all of a sudden we're in crisis?
Yeah. Yeah.
What would you recommend there if they don't want to call 911, or they don't, let's say they have something like an HMO where you're kind of, I don't want to name any, or maybe I should, something like Kaiser, where you just there, or if this is a mental or something emergency, call 911. That's how we're kind of ingrained to deal
Yeah.
with stuff. What are some alternatives in crisis
Yeah.
moments?
Yep. So there are community action teams, like different parts of the country. There are pods or teams that are forming in local communities to kind of show up and provide that support when needed. It looks like different things in different parts of the country. I mean, I've heard from mental health providers who are part of treatment teams on that front that show up for kids and families and really try to avoid an emergency room visit or hospitalization at all costs. That's not necessarily true of all these treatment teams,
Yeah.
mobile crisis teams. So it's highly variable and different depending on the locality, but less professionalized, more community-based action teams also exist and are out there. And it's just a matter of getting on the internet and starting to look
Yeah.
around or, tapping into social media. There are respite centers that exist around the
Mm.
country. For kids, not as prevalent, but I believe that they're out there. And the idea behind some of those respite centers is that they're not psychiatric facilities where you'll be involuntarily detained and asked to take
Yeah.
medication, but there's non-professional settings where people can come for a break and get the support they need and be safe. And then I think, there are providers out there who are thinking about these things. And I know from my own practice, I keep people out of emergency rooms and hospitals all the time, people from all walks of life. And that's very much, the focus and the priority because I know the harms that come with being in those facilities that a
Yeah.
lot of providers don't acknowledge.
Yes. Yes. I know we do hear it, some people like that's probably the best thing that ever happened to me.
Hmm.
And we also hear the other side of that. And I think my takeaway from this is our at least our conversation, thank you. It has been, if we are sensing something is going on, pay attention. Pay attention to the signs. Try to put ourselves in a place to be proactive so that we don't have to be reactive if we're noticing it with our kids or with someone that we love or even with ourselves. you know, Talk about it, reach out to other entities so that if it does come to a place of, oh my gosh, this just happened, we've got some things in our back pocket, some resources, and then we can make decisions on how to move forward based on education and being prepared versus panic.
Right.
Because I mean, there's a reality to all that. Yes. So, okay. Good conversation. I love this. Thank you for talking to me about all this because I know there's so many people that are in this position or find themselves in this position or will. And what I would love to do is, offer some kind of, you and I can talk, and if there's any kind of link or anything I can point to in our description and our comments, to really give people a place of hope and also to see more about the work that you do and help you get more of a voice of these awarenesses that you really are pulling the curtain back for all of us to see. You really are, and you're the first person that I've seen. To me, you're a front runner
Mhm.
in this voice and in this path. And so I want as many people to support you as possible because I don't want you to feel alone. That's my like, because, but I often know sometimes when we are a lone voice in the wind, that sometimes is the result, but
Yeah,
not always. It won't always.
not always, no.
Yeah, there's a movement happening and I love it. I love it. I
Yeah.
love it.
And I'll mention one thing. I think for people to tune into Paris Hilton's work would be good. So she's really taken on this troubled teen industry, these facilities, residential facilities that kids get sent away to that can be quite abusive and
Yeah.
dangerous for kids to be in. She was sent to one of them when she was a kid. It was recently shut down, and she's gotten laws passed in different states related to the regulation of these places. She did the same social justice lab that I did through Rise Justice Labs, where you kind of get a crash course boot camp in passing laws that aim to transform systems and hold them accountable. But she has done a lot of work on that front, has a documentary about it, and like I said, has been active in testifying and getting laws passed around the country.
That's great. That's great to know. I mean, who would have thought? I think some of us are like, who? Really?
Yep.
Oh my
Yep.
gosh. Yes. Love it. Okay,
Yeah.
one final question.
Uh-huh.
What has been a wonderful surprise from this journey you've been walking recently?
Uh, I would say that families from all walks of life, all extremes of wealth, privilege, marginalization, um, seeing the commonalities there. And,
Mm,
I am not one to minimize or mitigate what those differences are and the different challenges are, but to see that the same concerns related to mental health care and the same fallout is shaping them. I think that has been stunning to me, that the work that I do for folks who have just been through it in terms of layers of marginalization and oppression, extremes of poverty, and then to see the other extremes of wealth and access and resources, to see how much those people are also struggling with finding what they need for their kids and for their families. I think it's just been such a stunning indictment of what exists, which I was already aware of, but also I think it's just really made it even more apparent how much transformation is needed. The fact that families with all the resources on earth are struggling with mental
mm,
health care and getting their families what they need. You can only imagine how bad it is for people who don't have those resources. Yeah.
yeah. Yes. Mental health doesn't discriminate, but our systems do. So thank
Yeah.
you so much for what you're doing and bringing this all to light. And I can't wait to talk to you again soon.
Yay. Thank you.
Yes. All right. Well, have a wonderful day. I'm going to end us here.
All right.
Okay. Bye.
Bye.
Next week, I have a discussion with pharmacist Sherelle Joseph, also known as Dr. Rel. She's a woman who's active within many facets of her field. Dr. Rel shares some pharmacy knowledge from behind the scenes and how she focuses on healthy living practices for quality of life.
We are keeping you all safe. We notice the drug interactions. We notice the side effects. We know the drug disease interactions because we're seeing your profile every month.
I'm Chelsea. I help women discover and create our own version of quality of life so that we can actually feel good and enjoy the life we're living. See you next week.